exciting new study has been released at the World AIDS Conference in Washington, D.C. by the International AIDS Society, confirming that patients treated early and then taken off antiretroviral therapy have shown no signs of a resurgence of their HIV infection. There exists a unique cohort of patients in France who became HIV infected, started therapy early, and were able to successfully stop therapy without having a resurgence of their HIV infection. The study confirms the benefits of treating HIV at the very early stages of infection.
I'm Mike Kavanaugh from New York City. I run a website called HERONEWS.ORG for newly diagnosed people living with HIV. And I hate to say, but a lot of that went over my head, and I'm kind of filming this. I was wondering if you could just explain in a couple sentences, if I was going to say what this study is saying in layman's terms for people that aren't as scientific as myself or others, what you're saying.
It's better to start antiretroviral therapy between 350 and 550 than waiting till less than 250. So better to start earlier to reduce a variety of clinical events that can affect your overall health. Clinical events, developing severe HIV-associated illnesses like TB, or there's a class of diseases that are associated with more severe disease progression or more severe disease manifestations. So it prevents those from occurring, and it also prevents some more minor but still potentially bothersome clinical events like skin diseases or sores in your mouth.
Thank you, that really helps.
Do we have more questions or comments?
Just to make clear that it's very enthusiastic result, and it's kind of thing that can increase the convergence between the individual benefit, which is also including the treatment as prevention effect, because most of the people with HIV don't want to pass the virus, and so this is one individual benefit. And if we can see this health benefit, it's a very good point to increase the acceptability of treatment as prevention strategy. So this is great.
I would like just to comment on, as a follow-up of yours. Indeed, what we are looking after is to the people's benefit. And treatment as prevention is a secondary benefit. And what this study is showing, that treating people early is good for the patient. As a follow-up, viral load is reduced unless virus is transmitted. So treatment as prevention is a secondary benefit of the benefit for the individual.
Better said than I did. Thank you.
So any further questions or comments? If not, after the session, you might go, if you wish, to the session and talk to the other speakers that were not here. A lot of good stuff will be presented at the session at 4:30. I think it's in room 2.
I have to reference my schedule.
Okay, so if there's no further questions, thank you very much for being here, and enjoy the rest of the meeting.